Have you ever wondered how aid effectively reaches those in need? In complex humanitarian settings, the mix of quantitative data and qualitative insights is vital. This blend helps evaluators understand programs and their impacts more comprehensively. Let's dive deeper into mixed methods approaches and their significance. Monitoring and evaluation, or M&AMP, involves measuring progress and impact. In humanitarian contexts, this is crucial for understanding what works. Mixed methods combine numbers with personal stories, providing a fuller picture of program success. Step 1 involves collecting quantitative data. Surveys and routine data analysis capture measurable outcomes. This can include statistics on aid distribution or health improvements. Followed by this, we turn to qualitative methods. Interviews and focus groups reveal personal experiences and struggles. They help us understand context and emotion behind the numbers. Next, we consider psychosocial indicators. These crucial metrics gauge mental health outcomes in populations affected by crises. They must be culturally relevant and ethically sound. Validated indicators ensure we capture true mental health status without causing harm. To further illustrate, let's look at types of psychosocial outcome indicators. Indicators like depression or anxiety quantitatively measure psychological well-being, while social integration metrics gauge the quality of community support. This illustrates how varied the data can be. Implementing mixed methods also involves careful planning. It's important to ensure different data sources complement rather than contradict each other. Balancing rigor with practicality is essential. Humanitarian work often faces challenges like security issues and resource constraints. Moving on, let's discuss evidence synthesis. This methodology helps establish best practices based on existing research. Systematic reviews are common and provide summaries of what studies have shown. They help identify gaps in our understanding and inform decisions made by policymakers. Yet, evidence synthesis is often lacking in many regions, especially low and middle income areas. Engaging researchers and policymakers can bridge this gap. An impact-oriented approach linking evidence to policy has shown promise in improving outcomes. This approach includes 3 phases: priority setting, evidence synthesis, and uptake. First, we set priorities through studies or direct requests from policymakers. Next, we synthesize relevant data to answer these questions. Finally, we create knowledge translation products for effective communication. Now, let's touch on implementation science in humanitarian assistance. This field studies how best to implement evidence-based interventions. While known in global health, it remains rare in humanitarian settings. Understanding the distinction between global health and humanitarian assistance is crucial. Humanitarian contexts often deal with crises where standard systems break down. This requires unique approaches for effective service delivery. Key components of implementation science apply directly to these environments. Identifying problems and contextual barriers helps in designing tailored interventions. Partnerships with experts and iterative evaluations can enhance capacity and adaptability. However, many humanitarian organizations face gaps in research skills and implementation. Engaging with implementation experts early on could prevent duplicative efforts and ensure quality care delivery. In summary, mixed methods in humanitarian M&AMP are invaluable for capturing diverse impacts. Evidence synthesis helps shape informed policy. Implementation science offers frameworks for effective intervention in challenging settings. To make a difference, consider engaging in humanitarian efforts. Whether by supporting NGOs, advocating for evidence-based practices, or simply sharing this information, every action counts. Join us in improving lives through informed humanitarian assistance.